Is radiation from cell phone towers a clear health hazard to citizens? Yes, say many individuals who've been diagnosed with cancer and who live in close proximity to cell phone towers. But the government is focused on the situation and has set a deadline for radiation from cell towers to be cut down by 10% by September. But is there still a clear health risk to citizens? That's our big focus this evening on India Decides.
Just a year back, Sanjay and Pramod Kashliwal led normal, healthy lives in Jaipur. Today, both are fighting for their lives after being diagnosed with brain cancer within 4 months of each other. Was this a bizarre coincidence, or is there a direct link between their condition and the 3 cell phone towers which have been installed just a few feet away from their house?
When I filed an application under RTI to find out if these towers were authorized, they are very categorically written in that reply to my RTI letter that these are unauthorized. And then I met Mr. Milind Devda in Delhi, who is Minister for DOT. And there I was told that if these are unauthorized, they have to be removed. Yet no action taken by the government.
In just the last 1 week, the Delhi High Court has taken cognizance of 2 petitions made by citizens with concerns on cell phones and tower radiation. The court wants government agencies to take steps to reduce health risks from these tower radiations, respond to the petitioner's plea. The court also wants to know should companies that run cell phone towers display warnings. Cell phone operators in the country say India is well within the prescribed global standards for emission.
So nothing that we've seen from a credible, scientifically based study or analysis. We hear anecdotal evidence, but nothing that is scientifically based. And this is consistently what we've been hearing from the World Health Organization, ICNIRP, all of the credible governmental bodies have consistently said the same thing. No credible evidence.
But Matthew's views are questioned by those convinced of the dangers. They say the WHO study in 2000 shows that those who use cell phone for 2 hours a day have a risk of brain tumor. The Cell Phone Association of India says the study is non-scientific. Critics say India adopts radiation norms specified by International Commission on Non-Ionizing Radiation Protection, which are outdated and don't account for conditions such as cancer. Cell phone operators say the UK Public Health Agency report this year concluded there is no credible evidence to suggest any correlation between radiation from towers and mobiles on human health. So is this unnecessary public panic? Or are we all at risk? It clearly depends on who you ask. Preeti Agarwal, a resident of Delhi's posh defense colony, was worried about headaches and sleepless nights. Now she carries a radiation detector.
My mother was here, I had to send her back because I can't risk her life. All the time the radiation is so high, if you have seen the meter yourself, every corner of my house is at danger level. If I can't live in my house at peace or comfortable in my own house, where do I go?
The point debated all around is that not all mobile phone users get cancer, but extensive usage and greater exposure can lead to several diseases, including cancer. The government now needs to take strict action to set several minds at rest. With Bureau Inputs, I'm Sonal Mehrotra for NDTV.
India's #1 news app. Just got